Unravel the mysteries of ergocalciferol, also known as vitamin D2, as we delve into its myriad benefits. From promoting bone health to bolstering immune function, this essential nutrient plays a pivotal role in maintaining overall well-being. But what sets ergocalciferol apart from its counterpart, vitamin D3? As we explore the unique advantages of vitamin D2, brace yourself for a deeper understanding of this vital vitamin and its impact on your health. Whether it's combating inflammation or fortifying your body against certain chronic diseases, the benefits of vitamin D2 are not to be underestimated. Join us as we demystify ergocalciferol and unveil its incredible potential to optimize your health. Understanding ergocalciferol, vitamin D2. Ergocalciferol, commonly referred to as vitamin D2, is a type of vitamin D that is found in some plants and fungi. It is a fat-soluble vitamin that plays a crucial role in enhancing the body's absorption of calcium, promoting bone health, and supporting immune function. Unlike vitamin D3, which is primarily derived from animal sources, ergocalciferol is synthesized by plants and fungi when exposed to ultraviolet light. Once ingested, vitamin D2 undergoes a series of metabolic processes in the liver and kidneys to be converted into its active form, calcitriol, which then exerts its physiological effects on various tissues and organs. This conversion process is essential for vitamin D2 to exert its beneficial effects on the body. Vitamin D2 can also be obtained from dietary sources or supplements, and it is commonly used to fortify certain foods, such as dairy products, cereals, and orange juice. Additionally, exposure to sunlight can stimulate the production of vitamin D2 in the skin, providing another natural source of this essential nutrient. While the body has the ability to produce vitamin D2, certain factors such as limited sunlight exposure, dark skin pigmentation, and inadequate dietary intake can contribute to vitamin D2 deficiency, highlighting the importance of understanding its sources and benefits. The discovery of ergocalciferol in the early 20th century revolutionized our understanding of the role of vitamins in human health. Its identification as a vital nutrient for bone health and calcium metabolism has led to extensive research on its physiological functions and potential therapeutic applications. As we uncover the health benefits of vitamin D2, it becomes evident that this essential nutrient is not only crucial for skeletal integrity but also for immune modulation and overall well-being. Sources of vitamin D2. Vitamin D2 can be obtained from various sources, including dietary sources, sunlight exposure, and supplements. Some of the richest dietary sources of vitamin D2 include certain types of mushrooms, such as shiitake and maitake mushrooms, as well as fortified foods like dairy products, cereals, and orange juice. These fortified foods are often specifically enriched with vitamin D2 to help individuals meet their daily requirements. Additionally, some plant-based milk alternatives, like soy milk and almond milk, are also fortified with vitamin D2 to provide an alternative source for individuals following a vegan or vegetarian diet. Exposure to sunlight is another natural way to obtain vitamin D2. When the skin is exposed to UVB radiation from sunlight, a form of cholesterol in the skin is converted into pre-vitamin D, which is then further processed in the body to produce vitamin D2. However, factors such as geographic location, season, time of day, and skin pigmentation can influence the body's ability to produce vitamin D2 from sunlight. In regions with limited sunlight exposure, individuals may need to rely on dietary sources and supplements to meet their vitamin D2 requirements. Supplements are also a convenient way to ensure adequate intake of vitamin D2, especially for individuals who have limited access to sunlight or have dietary restrictions that may affect their ability to obtain sufficient vitamin D2 from food sources. Vitamin D2 supplements are available in various forms, including capsules, tablets, and liquid formulations, and they can be an effective way to address vitamin D2 deficiency and support overall health. Health benefits of vitamin D2. Vitamin D2 plays a crucial role in maintaining overall health, with a wide range of benefits that extend beyond its well-known effects on bone health. One of the primary functions of vitamin D2 is its involvement in calcium absorption and bone mineralization. By promoting the absorption of calcium from the intestines and regulating calcium levels in the blood, vitamin D2 helps to maintain bone density and prevent conditions such as osteoporosis and rickets. In addition to its role in bone health, vitamin D2 also modulates the immune system, contributing to the body's defense against infections and inflammatory conditions. Moreover, emerging research suggests that vitamin D2 may have potential benefits in reducing the risk of certain chronic diseases, including cardiovascular disease, diabetes, and certain types of cancer. The anti-inflammatory properties of vitamin D2 have been linked to its ability to mitigate oxidative stress and suppress inflammatory pathways, which are implicated in the development of chronic diseases. Furthermore, vitamin D2 may play a role in regulating blood pressure, glucose metabolism, and insulin sensitivity, highlighting its potential impact on overall metabolic health. Another noteworthy benefit of vitamin D2 is its influence on mental health and mood regulation. Adequate levels of vitamin D2 have been associated with a reduced risk of depression, anxiety, and cognitive decline. This suggests that maintaining optimal vitamin D2 levels may support mental well-being and cognitive function, making it an essential nutrient for overall mental health. As research continues to uncover the diverse benefits of vitamin D2, it becomes increasingly clear that this essential nutrient is an integral component of a healthy lifestyle. Ergocalciferol versus cholecalciferol, vitamin D3. Ergocalciferol, vitamin D2, and cholecalciferol, vitamin D3, are two forms of vitamin D that differ in their sources, metabolism, and physiological effects. While both vitamin D2 and vitamin D3 play crucial roles in maintaining bone health and overall well-being, there are distinct differences between the two forms of vitamin D that warrant consideration. Vitamin D2 is primarily derived from plant and fungal sources, whereas vitamin D3 is synthesized in the skin when it is exposed to sunlight or obtained from animal-based foods. This fundamental difference in sources contributes to variations in the bioavailability and metabolism of vitamin D2 and vitamin D3. Upon ingestion, both vitamin D2 and vitamin D3 undergo similar metabolic processes in the liver and kidneys to be converted into their active forms. However, studies have suggested that vitamin D3 is more efficiently converted into its active form, calcitriol, and may exhibit greater bioavailability compared to vitamin D2. This difference in bioavailability has raised questions about the relative effectiveness of vitamin D2 in raising and maintaining optimal vitamin D levels in the body. Despite these differences, both forms of vitamin D have been shown to exert beneficial effects on bone health, immune function, and overall health. The debate surrounding the comparative efficacy of vitamin D2 and vitamin D3 has prompted ongoing research to elucidate the specific roles and potential advantages of each form of vitamin D. While some studies have suggested that vitamin D3 may be more effective in maintaining optimal vitamin D levels, particularly in individuals with limited sunlight exposure, others have highlighted the potential benefits of vitamin D2 in certain populations, such as vegetarians and individuals with specific dietary restrictions. Ultimately, the choice between vitamin D2 and vitamin D3 may depend on individual needs, preferences, and health considerations. Recommended daily intake of vitamin D2. The recommended daily intake of vitamin D2, like other essential nutrients, varies depending on age, sex, and specific health conditions. For most individuals, including children, adults, and older adults, the recommended dietary allowance, RDA, for vitamin D2 is typically expressed in international units, IU, or micrograms, mcg. The RDA for vitamin D2 is established to ensure that the majority of the population meets their nutritional needs and maintains optimal health. However, it is important to note that individual requirements for vitamin D2 may vary based on factors such as sunlight exposure, dietary intake, and metabolic differences. For infants up to 12 months of age, the RDA for vitamin D2 is generally set at 400 IU, 10 mcg per day. This recommendation is intended to support healthy bone development and prevent conditions such as rickets, which can occur due to inadequate vitamin D intake during infancy. For children and adolescents aged 1 to 18 years, the RDA for vitamin D2 typically ranges from 600 to 1000 IU, 15 to 25 mcg per day, depending on age and developmental stage. These recommendations aim to facilitate optimal bone growth and overall health during childhood and adolescence. In adults aged 19 to 70 years, the RDA for vitamin D2 is usually set at 600 to 800 IU, 15 to 20 mcg per day, while individuals over the age of 70 may have slightly higher requirements, with an RDA ranging from 800 to 1000 IU, 20 to 25 mcg per day. These recommendations are designed to support bone health, immune function, and overall well-being in adults and older adults. However, it is important to consult healthcare professionals to determine individualized vitamin D2 requirements, especially for individuals with specific health conditions or those at risk of deficiency. Risks of vitamin D2 deficiency. Vitamin D2 deficiency can have significant implications for overall health. potentially leading to a range of adverse effects on bone health, immune function, and metabolic processes. Inadequate intake of vitamin D2, combined with limited sunlight exposure, can increase the risk of conditions such as osteoporosis, rickets, and impaired immune function. Individuals who are at higher risk of vitamin D2 deficiency include those with limited sunlight exposure, dark skin pigmentation, older adults, individuals with malabsorption disorders, and those following strict vegan or vegetarian diets. The consequences of vitamin D2 deficiency extend beyond bone health and immune function, as emerging research has highlighted potential links between low vitamin D2 levels and an increased risk of chronic diseases, including cardiovascular disease, diabetes, and certain types of cancer. Furthermore, vitamin D2 deficiency has been associated with an elevated risk of mental health disorders, such as depression, anxiety, and cognitive decline, underscoring the importance of maintaining adequate vitamin D2 levels for overall well-being. To mitigate the risks of vitamin D2 deficiency, it is essential to adopt strategies that promote sufficient intake of this essential nutrient. This may involve increasing dietary sources of vitamin D2, such as fortified foods and supplements, as well as ensuring adequate sunlight exposure when feasible. Regular monitoring of vitamin D2 levels through blood tests can also provide valuable insights into individual requirements and guide appropriate interventions to prevent or address deficiency. By addressing potential risk factors and optimizing vitamin D2 intake, individuals can safeguard their health and reduce the likelihood of experiencing the adverse effects of vitamin D2 deficiency. Supplementing with vitamin D2. Supplementing with vitamin D2 can be an effective strategy to address deficiency and maintain optimal levels of this essential nutrient. Vitamin D2 supplements are available in various formulations, including capsules, tablets, and liquid preparations, making them accessible to individuals with diverse preferences and dietary needs. When considering vitamin D2 supplementation, it is important to consult healthcare professionals to determine appropriate dosage, especially for individuals with specific health conditions or those at risk of deficiency. The choice of vitamin D2 supplements should take into account factors such as bioavailability, dosage, and potential interactions with other medications or nutrients. While vitamin D2 supplements can play a crucial role in raising and maintaining adequate vitamin D2 levels, it is important to use them as part of a comprehensive approach to overall health, including a balanced diet, regular physical activity, and sunlight exposure when feasible. Additionally, individuals should be mindful of potential contraindications or adverse effects associated with vitamin D2 supplementation and seek guidance from healthcare professionals to optimize their supplementation regimen. Supplementing with vitamin D2 may be particularly beneficial for individuals who have limited access to sunlight, such as those living in regions with long winters or individuals with indoor occupations. Moreover, individuals with specific dietary restrictions, such as vegans and vegetarians, may rely on vitamin D2 supplements to ensure adequate intake of this essential nutrient. By incorporating vitamin D2 supplements into their health regimen, individuals can take proactive steps to support bone health, immune function, and overall well-being, thereby mitigating the risks of vitamin D2 deficiency and its associated health consequences. Incorporating vitamin D2 in your diet. Incorporating vitamin D2 in your diet is an essential aspect of maintaining optimal levels of this vital nutrient and promoting overall health. While sunlight exposure and supplements play important roles in obtaining vitamin D2, dietary sources of this nutrient provide a natural and accessible means to meet individual requirements. Understanding the sources of vitamin D2 and making informed choices about dietary intake can help individuals optimize their vitamin D2 levels and contribute to their well-being. Some of the most notable dietary sources of vitamin D2 include certain types of mushrooms, such as shiitake and maitake mushrooms, which can be incorporated into various dishes to enhance the vitamin D2 content of meals. Additionally, fortified foods, including dairy products, cereals, and orange juice, are readily available options for individuals seeking to increase their vitamin D2 intake through dietary choices. Plant-based milk alternatives, such as soy milk and almond milk, are also enriched with vitamin D2 to provide additional options for individuals following a vegan or vegetarian diet. When planning meals and snacks, individuals can prioritize foods that are naturally rich in vitamin D2 or fortified with this essential nutrient to ensure adequate intake. Including a variety of vitamin D2-rich foods in the diet can not only contribute to meeting nutritional needs but also add diversity and flavor to the overall culinary experience. By embracing a balanced and varied diet that incorporates vitamin D2 sources, individuals can take proactive steps to support their health and well-being, ultimately reaping the benefits of this essential nutrient. Thanks for watching.